So one of the activities we have on our post-op protocol in the 0 to 8 week time period is that you should be doing log rolling to get up and down. And log rolling is something that hopefully you learned when you were in the hospital. Hopefully the nurses and hopefully a PT in the hospital showed you how to do log rolling. So I'm going to demonstrate what the log roll is, and this is to be used whenever you are getting up and down. And the reason we use the log roll, one is because it's more comfortable, there's less pain. But the second reason is we want the spine to stay aligned. We want the spine to stay straight, and the log roll allows us to do that. Just kind of like a log. How a log, if you roll it, it rolls as one piece. It doesn't bend. It doesn't do anything like that. We don't want to bend or twist the spine, especially during that 0 to 8 week time period. So the log roll is important, and the log roll is something that you'll probably be doing for a little while, and if your back's sore, it's a good way to do this. This applies to adults with scoliosis and kyphosis correction. This also applies to adolescents after they've had surgery for their scoliosis and kyphosis. So we're going to start with me laying on my back. So let's say you're asleep, you're laying in bed. I don't know if you lay on your side or not, but if I am laying like this and I go to get up, most of the time if we're not watching the back and doing the log roll, we'll kind of just sit up like this. The problem is that takes a lot of abdominal strength, which may be pretty hard after surgery, and it creates some twisting and some bending in the spine. So if I'm getting up, this table's a little bit narrow, but I'm going to scoot over a little bit so I have some room on this side. And then I'm going to roll onto my right side. Remember, we're keeping the spine nice and straight. And so now I'm laying on my right side, and I'm going to sit up using my bottom and top arm to push myself up. And my legs are going to come off at the same time. So I bring my legs off, and I push myself up like this. And now I'm ready to stand up. So when we go to lay down, it's the opposite. So we're going to sit on the edge of the table or the bed. You're going to go down onto your side, bring your legs up, and then you roll onto your back. And this table's a little narrow, so I'm almost rolling off. But that's the idea. Rolling up, sitting up, we roll onto the side, we push up with the elbow and the hand, and come up into that forward position, and then you stand up. That way you can keep your back nice and stable. Once again, in review, we lay down by coming down onto the side and then rolling over onto your back. So what we don't want to see is sitting up like this. We don't want to see, a lot of twisting as you roll up. Do it in that slow order. So roll onto your side, push up with your arms, let your legs come off. The idea is to keep your spine straight. So if you have questions, feel free to let us know. You can leave a comment on the video or on the webpage, and we would love to answer any questions that you have. But hopefully that helps reduce pain and protect your spine. Remember, that's during that 0 to 8 week and transitioning during the 9 week to 3 month period. So hopefully that helps. Thanks.